Okay,
Hi
great.
Janine, and thank you very much for coming in to talk to us today about mentoring.
Hi, Dominic. Really happy to come in. Thanks for asking me.
Right, thank you. Can I begin by asking you to describe your roles in relation to mentoring?
Yeah, sure. Quite a few. I guess I've been using mentoring for quite a long time now, and I try very hard to utilise it in every different role. So, for example, most of the stuff that I do is around education, postgraduate education. So I use it as part of my private mentoring, and I mentor dental professionals in a variety of ways in remediation. So they have a fitness to practice case with the GDC, but also in career mentoring and also with personal development. I also develop courses, so I've got a couple of programs that I've developed, a PG Cert and a PG Award, so that people can train in practical aspects of mentoring as well as the theory. And I try really hard to use the skills in all the roles that I do, so that you sort of have better conversations with people if you can use those skills.
And you're also involved with the network as well, right? The mentoring network, is that kind of
Yes,
something that
with a colleague, we developed the Dental Mentors UK, which is an online resource for mentors. So people who want to utilise the skills in whatever way. So we provide continuing professional development, because obviously you should continue to take forward courses when you do a particular role in dentistry, and we offer them peer supervision. So again, if you're a mentor, you really should have the opportunity to be mentored by a mentor. And we give them fact sheets and tools around the different things that they can use when they're mentoring. So it's an effort to try and keep up the skills and to raise awareness and make mentors even better than they might be.
Okay, so following on from that, then could you describe what mentoring means to you?
Well, I think I've experienced mentoring for a long time, but I never ever called it that, and I don't think we ever did. I mean, sadly, I've been qualified now quite a few years, sort of over 30 years, and mentoring was never really mentioned as something back then. But I was supported and encouraged by lots of people through my career that when I look back now, I would say was mentoring. They were giving me advice and encouragement and guidance, but not in a telling sort of way, but in a very supportive and encouraging type of way. And I think they made me a better dentist because of the way that they worked with me and the way that they've mentored me. And I've also experienced that through my network. I'm a great believer that we should all have a network. I don't mean the sort of social media type thing where you've got lots and lots of friends. I mean people, colleagues, professionals that you meet with on a regular basis, and you can talk through in a safe environment things you've experienced. And I now again realise that a lot of what I experienced through that network was mentoring. And so I think it sort of, if you like, rubbed off. So the skills that I found helpful, I reused and applied to people that I was working with. So I think it's just meant I've been a better dentist, really.
So there are both formal and kind of informal mentoring.
I think that's
what
true.
we sort of seem to be suggesting there.
Yeah, definitely.
And also you can almost have a kind of a network mentoring as well as a one-to-one or an individual.
Well, I think that's true, Dominic. I mean, a lot of my work is one-to-one.
Yeah.
So remediation, career would be one-to-one. But I've worked with practices where there's been a wider team that want to be mentored into improving the team. I have worked with remediation teams where one person has been struggling, but the whole team want to help that person, and that can be hugely successful.
Right.
So I think there are two ways. You're right. You can have one-to-one, you can have one-to-many, and again the formal and the informal.
Yeah.
Again, I think it's an interesting concept, because somebody chatted to me once and said, "Well, how are we going to find the time to do this?" And I think it's, if you look at it as I must find time to be a mentor, that's quite hard. But if you are being a mentor in every conversation that you have, you don't have to find the time. It just is you being a better dentist, a better professional.
supporting others.
Mm.
Great. Okay, so what would a constructive mentoring relationship look like then? You've sort of suggested, I think, some of the sort of the elements there. But if people were looking to establish a relationship, informal or formal, what might it look like?
Well, I think there's got to be a conversation between two people, and you've got to feel that you've got rapport with that other person. So you've got to feel that you trust them, that they won't be judgmental, that you can chat over issues that are causing you some concern. You've got to feel that that person has got some skills and experience that you would like them to share. But you've also got to feel that they can do that in a way that grows you rather than the more formal teaching relationship where you're just having knowledge shared with you. Not that that isn't very, very important, but I think mentoring is at a slightly different conversational level than teaching. So rapport, trust, skill, not just in the experience that you're looking for, but in how you are a mentor.
Okay. And how long do mentoring relationships sort of last? Are they kind of short things, or do they go on for years? Or
well, of course, they're both, as you might imagine, and it'll depend on what it is you're seeking from the mentoring. It can be quite short, just a few conversations. That might be something around career, might be somebody who wants mentoring on a particular thing, like applying for a specific job or thinking about a career pathway. It can be quite long. So some of the mentoring relationships I have with fitness to practice cases and remediation cases can actually go on for several years, because sadly that process can go on for several years. So it depends on what the person's seeking.
Okay. Again, you've sort of touched on a few things there. What recommendations would you give to anyone thinking of offering to mentor?
Well, I think the first thing is, I don't think every dentist, and that's every good dentist, regardless, every good clinician makes a good mentor. So I think I need to lay that down right at the beginning. I think the skills that make a good mentor are above and beyond good clinical skills. And so first of all, you've got to have experience and skill. And I don't think that's difficult for professionals to acquire. You can acquire that very quickly, actually. But then you've got to be able to have the mentoring skills that go with it. And that's about non-judgmental questioning, asking the right questions in the right way, being able to support people, be able to tease things out from people, as well as just the guidance. So I think I see the two as quite separate, the great skills and experience, but the great ways of being a mentor and actually working with somebody else.
Okay, and then so likewise then, what recommendations would you give to anyone thinking about being a mentee or trying to establish a relationship with a mentor?
Well, I think it's important that you seek out somebody who's got the skills and experience you're looking for. So if you're looking for specialist training, you might want to seek out a mentor in that particular role. But I think it's also important to see, have they actually done any training in being a mentor? And that doesn't have to be a formal qualification. There are lots of relatively short programs you can go on to understand how to be a mentor. And then I think you need to decide, is this a person I can develop a relationship with? Do I have rapport with them? Do I trust them? And will they work with me in a way that I find helpful? I suggest if it is a more formal relationship, ask them if you can have a taster session with them. And that can be on the phone as well as face-to-face, and just see what you think. There are lots and lots of mentors out there, and so you will find the one that suits you.
So you don't necessarily have to commit up front, not knowing about who that person is or anything. Actually, it's kind of feeling your way a little bit. And
I think
getting
so.
to know them and then decide whether or not.
Yeah, I think so. It's a very personal relationship working with a mentor, and you will click with some people and not with others. Even with people who've got huge experience and all massive skills, you may not be able to develop a relationship with them. And it goes both for the mentor as well as the mentee. So there could be times as a mentor that you feel, I just don't feel we've got that relationship, that I can help this person. I think it's best to sort of try it out, and then if people want to gracefully remove themselves, that's absolutely fine. And it's not because you're a bad person or a bad mentor, it's just not working.
In that relationship. Great. Okay, well, I think we've covered quite a lot there about mentoring. Thank you very much, Janine, for taking the time to talk to us about that.
You're very welcome, Dominic. Thank you.